Because of the concerns that have been raised about whether there are any negative effects of masking on children, there have been now numerous studies done, and these studies have unequivocally shown that there's no negative health effects on children from wearing a mask. We know that masks significantly protect both the person who's wearing them and the people around them. We are seeing an increase in other respiratory viruses that we don't usually see circulating this time of year, specifically two viruses, respiratory syncytial virus or RSV, and parainfluenza virus, which is a virus that causes croup. And masks, again, are effective in preventing the spread of these viruses as well. Wearing a mask will help decrease the number of symptomatic respiratory illnesses that kids have as well. Hopefully keep more kids in school and avoid having to quarantine if there are positive cases, and reduce the number of days off that parents need to take in order to take their kid in for testing if they were to get sick, just because these other respiratory viruses are also circulating now. Masking is recommended for anyone over 2 years of age. The other important part, especially in the pediatric age group, is the person wearing the mask should be able to remove it themselves if they need to. And so if your child has a neurodevelopmental disability, for example, or motor issues where they wouldn't be able to remove the mask if needed, then we do not recommend they wear a mask. The really important thing when it comes to kids is making sure that they're wearing it and making sure that they're wearing it properly. And so that means it should cover both their nose and their mouth completely. It should be comfortable for them to wear, and it should fit securely on their face without any large gaping areas or gaps. It's really important, especially since kids have probably grown over the last 18 months, to make sure that you increase their mask size as they grow, and before going back to school, try them on, make sure they all fit properly, make sure that they're labeled with your child's name so they don't get shared around with other children, and make sure that they're kept clean and in good condition. We do know that over 500 kids have died of COVID-19 in our country. We do know that there can be long-lasting effects from this infection that we're still really trying to understand. We still don't know kind of the impacts on developing organs, bodies, organ systems in kids, whether there might be other long-term impacts that have not come to light as well yet. And so when you look at all of those things, it becomes really important to do whatever we can to try and prevent kids from getting this infection. We also know that there's a rare complication, multisystem inflammatory syndrome in children, that can be life-threatening as well, and the only way to prevent that is to prevent kids from getting COVID-19. And so that's another reason why vaccination is an important part of preventive strategies for this age group.